Welcome everyone. In this video, we are going to explore a very interesting and important topic in epidemiology, family studies in epidemiology. Now, family studies basically help us understand how diseases run in families. Okay, so for example, whether they are caused by our genes, our environment, or let's say our lifestyle habits. Now, basically, in general, when we say family studies is about how families, how they live, how they grow, how they interact, and then how they care for each other, the kind of decisions that they make, how they go about solving problems, and then how that influence the health and the well-being of all the individuals across lifespan in a particular family. Okay, in general. So basically, one key thing that I always say is that families help us understand. Family studies is going to help you as a health professional to understand that the family is the first hospital, the first classroom, and the first support system of every person. Now, by the end of this lesson, you would understand how family studies help in identifying genetic risk, preventing diseases, and also improving community health. Okay. Now, for example, when you are caring for a hypertensive patient, the nurse not only administer medications and monitor blood pressure, but also studies how the family diets, meal preparations, and awareness of hypertension affects the patient's recovery and long-term control. Okay, so the whole idea with family studies is to help you to, come to the realization that sometimes it's not just about getting to know or focusing on just some interventions or focusing on numbers. But there are times we need to come down to the family level, the individual level, get to study certain practices or certain beliefs of the family, which are likely to also influence health or lead to the occurrence of certain disease. Okay, so that is all that family studies is about. So family studies in epidemiology basically examines how genetic inheritance, that's the key thing, how shared environmental characteristics or shared environment and lifestyle factors within families influence the occurrence and distribution of diseases. Okay, that is all that family studies is about. So for example, if hypertension or diabetes is common among several members of the same family, epidemiologists or researchers can ask questions like, is this due to their genes, or is it because the family share similar diets, or is it because of physical activity levels among the members of the family, or is it because of the stress patterns of the family? Is that okay? Probably there is a family business that is stressing the family line, okay, which probably is leading to the occurrence of that disease. Okay, so family studies in epidemiology is going to help us determine whether disease is mainly hereditary or environmental related or a combination of these two factors. That's the focus. Okay, now, why is this important? This is important because it's going to allow you as a health professional to identify high-risk groups, okay, and also design early prevention strategies. Is that okay? Family-centered or community-centered strategies, all of which can help, solve certain problems or health-related problems. Okay, so family studies in epidemiology examines how genetic inheritance and the key shared environment and certain lifestyle factors within families influence the distribution and also the occurrence and prevention of diseases. Okay, great. So basically, that is it for family studies. Now, why is family studies important? What's the purpose of family studies in epidemiology? What is their purpose? Why do we have to study family studies. Now, the first point is to identify genetic predisposition to diseases. Okay, a practical example can be, for instance, breast cancer, or let's say sickle cell diseases. Some diseases often runs through families. Okay, and the focus of family studies is to examine how genetic inheritance within families. Is that okay? Good. So studying family studies in epidemiology can help identify genetic predisposition. For example, there is a disease and we want to study the individuals to know whether there are any genetic related factors. Okay, having family studies in mind would help you to get more information or more details. Okay, or it will bring you to the consciousness that in studying individual or studying a population, sometimes family studies, getting to know how the possibility of genetic association is very important, or may sometimes play a role in the occurrence or distribution of certain diseases. Now, family studies can also help us distinguish between genetic and environmental causes. Okay, because you see, family studies focuses on the two. Okay, how genetic inheritance and shared environmental factors within a family. Okay, so family studies can help investigators or researchers know whether the changing environment. Okay, but sometimes people may be genetically predisposed to certain diseases, but sometimes environment may also play a role. Okay, so family studies may help you to distinguish between genetic and environmental causes of diseases. Is that okay? Good. And that can help researchers know whether changing environments within a family can reduce the risk. Okay, good, or increase the risk of developing certain diseases. Now, again, family studies can help detect high-risk families or high-risk groups. Okay, good. And with that, that is very important in epidemiology, because when it comes to problem solving or development of interventions or disease prevention, that can help prevent, and also it can alert us, or it can make us conscious on early screening, prioritizing early screening to help minimize or prevent certain diseases from occurring. Okay, now family studies can also guide preventive and control measures. For example, targeted health education or vaccination programs or targeted interventions, okay, for some community or for some families. Okay, good, because with family studies, we are going to the family level. Is that okay? Good. And if in case we should identify any related environmental factor or lifestyle factors, or shared environmental factors or shared lifestyle or practices or habits within a certain family, we know how to plan, and also to educate. Okay, all these things will come together to help prevent or solve the problem. Now, family studies can help improve health planning and service delivery. Okay, family studies can help improve health planning and service delivery. Okay, so for example, with family studies, you can study multiple families and you get to know some common. So you enter a community, you begin to do family studies, you study multiple families, you realize, you get to know that maybe there is some recurring practices or frequently occurring practices that you think is detrimental to the health of the people, or is contributing to negative health outcomes within the population. You can put in place interventions, or you can develop strategies, okay, to address that situation. So family studies can help improve health planning and service delivery. Family studies too can help to understand disease transmission, okay, patterns within families. Okay, because family studies is about genetic inheritance, shared environmental, shared environment, and how all these things contribute to diseases or contribute to health. Is that okay? So, for example, if there is any disease occurring in the family and you think it's as a result of shared environment or shared dietary practices within a family, or maybe genetic predisposition, okay, within the family, okay, studying family studies can help you understand the disease transmission. Do you get it? The pattern within the family. And with that, you'll be able to, put in place measures, to prevent or prevent future occurrence, or also even try to, prevent the disease from occurring in the next generation or the future generation. Okay, now to provide data for genetic counseling and public health interventions. Okay, now family studies can also provide data for genetic counseling. Is that okay? And also public health interventions. Now, family studies can help promote family-based approaches to disease prevention and control. Okay, now let's move on to family-related factors that contribute to disease occurrence. Family-related factors that contribute to the occurrence of disease or disease occurrence. Okay, now these family-related factors, these factors can be grouped into three main categories. Now, the three main categories, we have the genetic factors, we have the environmental factors, and we have the behavioral and lifestyle factors. And you see, these three factors, studying these factors is all that family studies is about. Okay, so like I mentioned earlier, family studies is about examining how genetic inheritance, shared environment. So we have the genetic component, the shared environment, and then the lifestyle component. Okay, how they can influence the occurrence, the distribution of diseases in a population or in a family. Okay, now, so the family-related factors that can contribute to the occurrence of a disease. One, we have genetic factors. Two, we have environmental factors. And the third one, we have behavioral and lifestyle factors. Now, with the genetic factors, you need to understand that certain diseases are inherited within families. You need to understand that. We have several diseases that are inherited within families. For example, sickle cell disease, diabetes mellitus, breast cancer, and even hypertension. Okay, now there are so many diseases that we have genetic linkage. Is that okay? Good. And sometimes this genetic linkage studies can help trace how these diseases are passed down from one generation to another. Okay, good. In biochemistry, we have what we call the family pedigree chart. In biochemistry, family pedigree charts that scientists or biochemists can use to do genetic linkage studies, which can help them trace the patterns of inheritance of certain diseases in a certain family line. Okay, good. Then we have what we call the environmental factors. Now, with environmental factors, families usually share the same living conditions. Most families usually share the same living conditions. Okay, like housing, conditions like sanitation, and even diet. Okay, so for example, overcrowded homes and poor sanitations can increase exposure to diseases like tuberculosis or even cholera and even malaria. Is that okay? The same way, shared diet like high in fat, diet high in sugar can also increase the risk of obesity and heart diseases in a certain family line. Is that okay? And all these can influence the occurrence of diseases in a family. Okay, now with regards to the last point, which is the behavioral and lifestyle factors, most families also share certain habits, such as smoking, okay, alcohol use, or even physical activity. Okay, and sometimes these behaviors are often, learned and maintained within the family setting for a period or for a long time. It's maintained within the family. And we also have family norms, family values, okay, all of which play major roles in shaping how, family members respond to illness and also even health education. Is that okay? So, all these come together should tell you that, family-related factors really plays a major role in contributing to disease occurrence. Okay, so the genetic factors, the environmental factors, the behavioral and lifestyle factors, all these come together, play, a huge role in influencing the occurrence of disease. And that is why family studies is very important in epidemiological studies, or very important in epidemiology. Okay, now let's look at the family influence and role in disease prevention and control. First of all, we will look at family influence on access to healthcare. Okay, now understand that families don't just share genes and habit alone. Okay, families also influence how individuals also access healthcare, and that is also very important. So the family studies is not just about, sharing lifestyle practices, the shared environment, the genes or the genetic factors. Not only that, families also influence access to healthcare. Is that okay? For example, socioeconomic status. Okay, it is very likely that families with higher income and education will tend to afford preventive care. Okay, like health insurance and quality medical treatment. Okay, so families that are of higher socioeconomic status, they are more likely to have access to quality health care. Okay, and that can also influence or have an impact on their health. Do you get it? Good. Then we have health seeking behavior. Now, in some families, the decision to actually seek care depends on collective beliefs. For example, some families, they prefer traditional medicine before visiting hospital. Yes, some families. And there are times that even families, we have health professionals who belong to some families that sometimes, because of family influence, they tend to, believe in certain treatments, okay, than visiting the hospital. Is that okay? So, and this is the reason why family studies is very important, because all these beliefs and perceptions, attitude, all that can influence access to healthcare. So there are times that there are so many conditions that sometimes by the time the patient or the client even come to the hospital, it has gotten to the worst stage, delay in seeking healthcare. And these factors are mostly as a result of, influences from the family and influences from friends or community members. Okay, and these are some of the reasons why family studies is very important. Okay, also we have support systems. Okay, family members often provide emotional, financial, and physical support during illness. And this support is very important, okay, to the recovery of the sick person or the individual. And also this support is very important in treatment adherence. Okay, good. So, in most families, after a patient, for example, a patient was admitted, treated, and discharged. As the patient goes home, the patient now needs the support of the family. And sometimes this support will be very essential towards the patient even adhering to the discharge medications or the treatment at home. Is that okay? So the family support is also very essential. Is that okay? So, and all these things, so the socioeconomic status, the health seeking behavior, the support systems, all these things play a role and can influence, access to healthcare. And access to healthcare is also very key when it comes to the occurrence of disease or prevention of diseases. Okay, good. It's very key. Now, the next thing we will look at is the role of the family in prevention and control of diseases. Now, let's discuss how the family play role in preventing diseases. Now, how is the family able to do this? Promoting immunization and proper nutrition. The family plays a role in immunization. There are times that, encouragement from family, okay, or words that are put in by family members, okay, can encourage, the family acceptance of immunization programs or the family acceptance of, certain dietary practices or habits. Is that okay? And all these are very important or plays a role in disease prevention. Okay, encouraging personal and environmental hygiene. Okay, encouraging personal and environmental hygiene. Supporting screening for hereditary or lifestyle disease, such as, for example, like hypertension and then breast cancer. Is that okay? Great. So there are times that the families can encourage. You can have a member of the family encouraging another member to go in for health screening. Is that okay? And all that plays a role in disease prevention. And that is the reason why family studies is very important. So that as health professional, you will not just, be looking at people, focusing on just the individual. You'd also consider the family. And that's how come sometimes nurses and midwives, other health professionals, they do home visit, follow-ups, and use that as an opportunity, like the public health nurses and then, the health practitioners. They go to the community health nurses. They go to the homes of people. They educate the family members. Okay, so that then they all play a role. Is that okay? In helping to encourage one another to seek for, healthcare services, and also all that will come together to help with disease prevention and control. Now, reinforcing healthy lifestyle. Okay, like regular exercise, balanced diet, and avoiding harmful substances. And one thing you should know is that with all these being said, when families decide to work together to maintain health, they actually become a foundation for a healthier community. And once we have a healthier communities, you end up having a healthy region, or a healthy state, then a healthy country. Is that okay? Good. And you see, this is why family studies is very important. Okay. So, family studies in epidemiology basically help to bridge the gap between genetics, environments, and then behavior and lifestyle. Okay. And this help us understand why diseases occur the way they do. Okay. And how prevention should start from the family level. Okay, so it's very important that prevention, we start it from the family level. Okay, because you see, healthier families would end up forming a healthy community. Is that okay? Great. So now let's look at this scenario. Okay, let's look at this scenario. So in a particular town in Accra, there was a family called the Mensah's family. Now, in the Mensah's family, the grandmother, who was called Madam Akua Mensah, was earlier diagnosed with hypertension in her early 50s. Now, her oldest son, who was also called Kofi, her oldest son also developed high blood pressure in his 40s. Okay, now, Kofi's 25-year-old daughter, who is also called Ama, probably, has also started showing slightly elevated blood pressure readings during her routine, blood pressure checkups or routine checkups. Okay, now as an epidemiologist, okay, you have this scenario ahead of you, you have this story ahead of you. As an epidemiologist or maybe a health researcher, you have to now begin to ask a lot of questions with family studies in mind. That is the hypertension in Mr. Mensah's family caused by genetic inheritance? You ask yourself questions because family studies is not just about genetic. It's not also about the environment. Okay, and it's not also only about the lifestyle factors. So as an epidemiologist with family studies in your mind, you are thinking about three things: genetics, shared environment, behavior, and lifestyle. Okay, so you ask yourself questions. Is the hypertension in Mr. Mensah's family caused by genetic inheritance? Or is it due to the shared lifestyle habits, like their love for salty foods or salty soups or processed foods? Or is it because of limited physical activity in the family? Okay, so now when you, the investigator or the epidemiologist, you study the family and you find something interesting, probably maybe there was a genetic predisposition to the hypertension, and that means that the risk was partly inherited in a way. Okay, but then you can also notice that all the family members had similar eating habits. Okay, all the family members were not exercising, their exercise levels were very low. Okay, and also maybe probably even notice that they even have tendency to delay medical checkups. Okay, and that will tell you that, okay, then both the genetic, environmental, and lifestyle factors all comes to play. Do you get it? And this is what family studies in epidemiology is all about. It's going to help you to discover how genes, how our environmental, shared environment, how shared practices or certain lifestyle practices, all of them combine and influence the occurrence of disease, or the patterns and occurrence or distribution of diseases in families and even to communities. Is that okay? Do you get it? So now once once you as a health professional, you've now identified that, the Mensa family, they are high risk. Okay, because now you've identified some genetic association, you've identified some lifestyle practices that are common, you've identified some shared environmental practices like their diet and things that are contribute to the disease. You get, so now you can tell that, okay, then the Mensa family, they are high risk. So you as a nurse or a health worker, okay, you are going to guide them on the lifestyle changes that they have to make. For example, reducing salt intake, like increasing their physical activity, and even doing regular blood checkups. Okay, now if you give them all these advice, okay, all you are trying to do is that, okay, you are helping to prevent future occurrence of the disease. Is that okay? Good. And this is all that family studies is about. Okay, this is all that family studies is about. Okay, so in summary, family studies in epidemiology examines how genetic inheritance, shared environment, certain lifestyle practices or behavioral factors within families can influence the occurrence of disease, and also the distribution of disease, or can play a role in prevention of diseases in families. Okay, I wish you guys all the best. I'll end here for the series on family studies. Thank you all. See you in our next lesson. Bye bye.